The video opens with a logo featuring a gold oak leaf encircled by the text School of Health and Public Safety. Footage follows of nursing students using VR headsets and controllers in a colorfully lit lab, while monitors display 3D hospital room simulations.
Virtual reality is an immersive technology that students can be immersed into a scenario in which they feel that they are right with the patient. Virtual reality is used in the classroom as screen-based, and we can also bring our students into the virtual reality lab where they can actually put the headset on. We can also use it as a remote option via screen-based.
Cassie Vandehei, nursing instructor, appears on screen.
Reality helps instructors by providing an activity where students can be immersed into a scenario and they can be immersed independently, where it's self-paced.
A UTI.
A nursing student wearing a Nicolet College patch uses a VR headset, while a monitor displays a 3D hospital room with patient avatars.
Patients have low back pain, and they can have a tinge blood in their urine, and she does have a temperature of 100.
In a lab with partitioned workstations, 2 students wear VR headsets. Close-ups show hands using controllers, while a monitor displays a virtual hospital room with an avatar walking between beds.
And they can also be immersed where they can work as a group together on a patient. Instructors have the capability of being creative with the scenarios also, and they can adapt to the decisions made by the student. And we can also jump from one scenario to the next.
Inside the simulation, floating controls adjust the hospital bed. Patient scenarios shift, from an adult in a hospital gown to a masked child in a pediatric room. A first-person view shows virtual hands reaching toward floating charts and equipment.
So we can go from birthing a baby, we can then go to a mass casualty event. The benefits to students, they can be immersed into these scenarios where they can make mistakes safely and they can learn from the mistakes that are made.
In the lab, Cassie Vandehei observes as a student navigates the simulation.
Where these may not be encountered at clinical sites.
Cassie and 3 students gather in a small meeting area for discussion.
Running the scenarios in small groups with 3 to 4 students is where we see the real growth. Seeing the students connect the pieces, they can bring what they learn in the classroom, they can bring it to the headset and they can use their skills. We can see the development in their critical thinking skills, what decisions that they are making, and really see the light bulbs go off.
The scene shifts to a physical skills lab. Students in gray scrubs practice on mannequins and hospital beds as a monitor displays simulated vital signs.
We have a
Jackie Tisignant, nursing instructor, wears a blue Nicolet College zip-up jacket.
variety of mannequins. We have basic ones that students can do repetitive practice on. Mid-fidelity simulators that students can start IVs on and do a little bit more. They can do CPR on the mannequins.
2 students perform CPR on a mannequin. One compresses the chest, while another manages the airway with a bag valve mask.
We can do a little bit more procedures. And then finally, we have our high-fidelity mannequins that we use in simulations. So we have 3 different high-fidelity simulators. We have a birthing simulator, Victoria, and then we have an adult male, and then we have a pediatric 5-year-old simulator.
The pediatric mannequin sits in a wheelchair, wearing a hospital gown.
And those ones can have all kinds of things done to really mimic a real patient. Take some imagination.
A student tends to a mannequin wearing an oxygen mask.
They do communicate. They do have lung sounds, heart sounds, bowel sounds, so that sounds realistic. The high fidelity simulators, the advantage with those is we can do things that we can't expose students to in clinical. So we can't do high-risk situations. We can't expose them to those type of life and death emergencies. They may observe it, but they're not going to be interactive. Where we bring them here with the high fidelity simulators, they can be interactive. We can evaluate how effective they're doing CPR with our equipment. It'll tell us, track everything that they're doing and how effective
A monitor displays real-time waveforms and numerical vitals.
they are at that, so we can give them real feedback. Students enjoy the safe practice, because it's a safe place to make an error. Simulation is our safe place to do those high-risk situations where afterwards we debrief and figure out what would we do in the future if we had to encounter that. So it's a safe place to practice and make a mistake and learn from it.
The School of Health and Public Safety logo returns, then transitions to the Nicolet College logo as the video ends.